Welcome to Field Notes, Insights from N2 Public Health Alumni. N2 Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2 Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making.
Joining us today is Joey McMahon, Research and Policy Coordinator with the Milwaukee Public Library in Wisconsin. Joey graduated from the N2 Public Health Residency Program in December of 2023. Thank you for joining us today, Joey. Could you please tell us more about your background and your transition into public health?
Yeah, for sure. I graduated from Zilber School of Public Health at UWM in May of 2022 with a Master's of Public Health in Public Health Policy and Administration. During my schooling, I was able to kind of find a role at the North Shore Health Department as a public health assistant, which was great. Kind of able to get that experience of working at a health department while also getting my master's. And then upon graduating, I was actually able to get a promotion to public health specialist, which was also great. I stuck around for another year. Since then, I've actually been, I found a new employment at the Milwaukee Public Library and just kind of moved on from there, which was it was time to move to a new sort of location and sector, I want to say. But coming from public health, yeah, I really learned a lot of theory with my master's program. I think the biggest difference between having worked in public health and having been my education in public health is sort of that theory to practice. We don't really focus on the inner workings of a local health department or how the public health sector works in everyday life. It's more research focused, which is totally fine, and highly focused on research methods, which again, we all need to know how these research is conducted, but I think there should have been a little bit more with that sort of practice and sort of boots on the ground approach that happens at local health departments.
So when it comes to putting practice into the theories that you learned at grad school, do you feel that N2 Public Health residency program was beneficial in helping you do that? And at what point in your career did you find N2PH?
Yeah, I would definitely say it helped me put that theory into practice. It wasn't until I graduated and was a public health specialist, so maybe about a year, 6 months after graduating my master's program. Yeah, I definitely think sort of having that open line of discussion with the N2 Public Health preceptors as well as other students or young professionals in my role or in other roles. It was great to have that discussion with what other people are doing at different health departments and what they're doing in a rural setting, what they're doing in a city setting. And then also being teamed up with sort of that mentor wherever they may be located. I think that was really great to discuss other topics with them as well.
Not everybody comes into N2 Public Health with a master's in public health. So you bring a different perspective. How did you feel about having an MPH and then going through N2 Public Health?
Yeah, I think that it was a very beneficial program for both people who don't have any education or history in public health, as well as people who have just graduated with their master's or even undergrad in public health. I will say I wish I would have done it a little bit sooner after graduating. I think just kind of working in that environment gave me some more experience. So some of the topics that we had learned were what I had done already in my role as a public health specialist. So it kind of just supplemented what I was doing. But then other topics like the disease prevention or disease investigation was really interesting because that's something that I was just learning in my role. So kind of learning as I went was really beneficial as well.
Awesome. I think maybe just to wrap it up, we would love to hear about some of the work you're currently doing with the Milwaukee Public Library, as it does seem maybe a little out of the
Hmm.
realm of public health, but we know public libraries are great partners for local health departments. So can you tell us more about what you're doing at Milwaukee Public
Sure.
Library?
Yeah. I just want to say that I've always been sort of data or numbers focused. I said my top two choices for my track were either public health policy or either biostats. So I did go the policy route, but I've always been interested in sort of data and numbers and data visualization, and that kind of has what I'm doing right now for the library. I didn't realize how much data the library collects on a monthly basis or daily basis. You just think of, oh, I'm going to go to the library, check out a book, check out a movie, use the computer, but that's just part of the picture that we kind of paint at the library. Um, the big ones that we use are the patron visits, which are foot traffic into and out of the building, as well as circulation, which is, again, taking a book off the shelf, checking out a book or other media. Another huge one that we use is both computer and Wi-Fi usage. Uh, we have a lot of people that bring their own devices to connect to the Wi-Fi and do whatever they uh, please on their own devices. Um, and that's been a big one in the last couple of years, is that our Wi-Fi has really been uh, ramping up since the pandemic. Um, so all of that data is collected, and then also I create these annual reports. This is a big time for annual reports this month and next month, both internally and then externally. We report out to the Department of Public Instruction with the state of Wisconsin. And then mainly the other one is the monthly board reports. I create the statistics, or I create the statistical graphs that are shared with the library board, and those are presented every month. So yeah.
Awesome. Thank you so much, Joey. Um, it's exciting to hear from a graduate that has transitioned into something different and also something that is supporting social determinants of health and public health work. So thank you for sharing your story with us today. Thank you for listening to Field Notes, insights from N2 Public Health Alumni. For more information on the N2 Public Health Residency Program, visit new2publichealth.wisc.edu. Thank you.